I'm going to call the Health and Human Services Committee meeting to order, and it is Wednesday, January 7th at 3 p.m. So we will start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to number 3, public comment. There was no public comment, so we'll move to number 4, approval of the November 5th, 2025 Health and Human Services Committee meeting. Do we have a motion? Second? Bill, okay. Any questions? All in favor, say aye. Aye. Opposed? Carries. Moving on to number 5, operational functions required by statute, ordinance, resolution, or policy. 5A, discussion and possible action by HHSC. B, discussion and possible action by HHSC to forward to County Board for consideration. Number 1, request to amend the 2026 budget to accept transportation grant funds from the Wisconsin Department of Veterans Affairs.
Well, I'm not going to talk much at this meeting, so Lori and Aaron can take this.
I guess I'll start.
There's a memo in the packet, though, that starts on page 3, just for background.
Yeah, so in November, we brought to you all a request to apply for funds from the Wisconsin Department of Veterans Affairs for transportation funds that could be used to transport veterans to the VA in Rothschild. We did apply with your approval, and we were told that we will receive just under $3,500 in funds for 2026. So we do need to request a budget amendment. It was not in our 2026 budget. It would go into the CPZ budget. We would couple it with 8521 funds that are received and work with North Central Healthcare to provide veteran transportation to the VA for elderly veterans is how we would start that. We've also been working with the Veteran Services Officer to potentially look for additional grants and or solicit donations, possibly to expand other transportation services that we could provide for veterans. I'll let Aaron add anything else he would like to add to this request.
Yeah, that's really the main thing. We're just looking to figure out how we can improve the program or how we can continue to fund it, whether it's through local organizations, through donations like from Man of Honor Society, the Elks Club, or whatever it may be, if the program or the grant were to ever go away, so that way we can continue getting the veterans to the VA clinic. That's one of the big struggles we have with a lot of our elderly veterans. So the goal of this grant is rural veterans and healthcare, getting them into the VA clinic and making sure they have access to it. Most of our older veterans who are unable to drive themselves or can't get transportation because they have medical necessities just don't go to the clinic. So now we have an option to get them there at little to no cost or at no cost with the help of this grant. And we just want to figure out how we can continue to make that better. So.
Thank you. Are there any questions?
Madam Chair?
Yes.
The only question I have is how for this program to be effective, and I know I was the one that was supportive of this as well, how much more funding do we potentially need, to ensure that any gap services is filled? I know it's kind of like a long, it's a loaded question, but I'm just kind of curious as to how much would need to be raised to fully support our veterans.
I don't know that we do have a definitive number. We have talked about it. I think one of the things we would like to do this year as well is try and work on a survey to get a better sense of the entirety of the transportation needs for veterans. But I think we talked about getting another 5,000 to 10,000 would be very beneficial to really help us get started. So,
Yeah, and
Thank you.
the reason that we're hoping to, this is kind of like our trial year with this grant, because we can figure out from beginning of the year to the end of the year, how much of that fund and how long it's going to last. And that really will ultimately determine regular amount of funds that we would need outside of this grant if we wanted to make it free for veterans or at reduced cost for veterans for the whole year. So that's where we're going to start. We're going to see where it goes from there. And if we can navigate it from there, that would be fantastic. But I'm fairly confident, speaking with some of our local stakeholders, the veteran organizations, that we would have no problem getting some kind of donation if we would need it, whether that's reoccurring or not.
Thank you. Any other questions?
I'd like to make a motion to approve the amendment to the 2026 budget, accepting the Marathon County, Wisconsin Department of Veterans Affairs grant.
We have a motion and a second. Any other questions? Yes.
So does this go to HR Finance then, or to the full board? HR Finance? That's fine.
All right. Seeing none other questions, those in favor, say aye.
Aye.
Opposed? Okay, it carries. Moving on to number 6, educational presentations and committee discussion. 6A, recognition of the 2025 Children's System of Care Champions.
All right, well, Chris and I are going to speak to this. So actually, I brought the plaque to show you too. So we're very proud of this plaque and what it really means for North Central Healthcare and our partners, specifically our Marathon County Department of Social Services partners, as well as our social service partners in our other counties. So to show you how much this means to us, I want to just go back a few years. So those who've been on the board for more than 3 years, say about 5 years ago, that you know that there were some disconnects between our social services partners and North Central Healthcare. And at that time, I was on the social service side of things. And there was a vision to make some changes to better align the services that we provide, specifically for children and their families. And the executive committee worked to change and update the Tri-County agreement to clarify expectations of working together differently. And then the whole structure of North Central Healthcare leadership was changed to be able to move forward with the vision. And I did give you our, this is a vision statement or a desired future state. Lance, if you need another one, we'll give you another one. But the committee has, the executive committee itself designed this vision statement and then has updated it over time. And this is really what we are moving towards, and what all the decisions that we make are to support this desired future state, which is us working together to seamlessly deliver services to adults and children. But in this case, we're going to talk about children because of the award that came from the Children's Come First Committee. So it's an honor receiving this award. At North Central Healthcare, we were chosen out of 19 organizations statewide, and we are nominated by a state department. And the reason that we were successful in receiving the award is because of our partnerships that we have established over the last 3 years. In addition to that, it's about our continuum of care that we have at North Central Healthcare. And there is a one-page paper in the packet that reminds you of the various services we have for youth that is very unique in the state of Wisconsin. Our 3 counties are the only ones who have all of those services under one, at least on one campus, if not under one roof. So it's very unique and provides us with opportunities to be able to meet families where they are and serve in the least restrictive manner, which is of course required by law, but it's also in the best interest of children as well. So 3 years ago, a little over 3 years ago, when I started my job at North Central Healthcare, we formed a human services leadership team. And Chris is on that team as a social services director with the other directors and myself and our executive director, Jason Hake. And we have met pretty much monthly for the last several years to improve communication, improve collaboration, figure out how we work better for those families that we serve. We've done numerous educational sessions about learning more about child welfare from the North Central Healthcare perspective, as well as child welfare, learning more about everything behavioral health-wise. So we've made great strides. A lot of our miscommunication in the past simply came from people not understanding what our responsibilities were statutorily and what our limitations were. So have done a lot of work around that and just kind of leveling expectations. One of the other things that we have done is we have created a mechanism to have complex care reviews. So for those children and families who bring the highest needs for us, Instead of, we work really hard to not go, that's yours, or that's yours, and that's how you need to work with that family, it's your responsibility. But instead of that, to come together and say, this is a complex issue, what can we each do to move forward, and let's at least try this first. Krista, I think, can talk to somehow it's impacted their services for the children that they serve, including delaying out-of-home care placement or bringing kids back sooner. So there is a financial benefit to this continuum of care of services, as well as to the collaboration to the county specifically. I think the last thing that I would like to say is that we have tremendous staff working at North Central Healthcare, as well as I know our social services departments, but we're very proud of the work that we do at North Central Healthcare. It can often be a very stressful job with all the different services that we have, but we have extremely quality staff who are very dedicated to what they do. The other thing I will mention is that in terms of the financial, the counties provide a lesser level of levy to us to operate at North Central Healthcare than comparative size counties. So in other words, the services that are being delivered with less levy than other counties in the state. So I'm not sure if you all knew that, but I know Lance knows that. And that is something that we like to call out because we're able to do things very efficiently and can maximize grants and just the usage of our programs and being able to use insurance, Medicaid coverage to be able to pay for services so that we can provide these services without needing to ask for an extreme amount of levy. So something else that we're really proud of. So just really wanting to shout out this accomplishment that we are definitely noticed for our collaboration at the state level. So with that, I'll turn it over to Krista.
Yeah, I don't have much more to offer other than the last 3 years. I think it's been really eye-opening for everybody to be able to sort of all come together as a coalition to support families instead of, like Vicki mentioned, that's your responsibility, that's yours, and we can understand each other's statutory requirements better and have those conversations about how do we support families. We are very lucky to have the resources that we do at North Central Healthcare. I get to be a part of a lot of other meetings with other directors who don't have those resources and to have them here in our community. We truly have seen the ability to maintain children here, particularly with our youth hospital, speaking from a social services side, and with the youth crisis stabilization facility, whether that's keeping them here or the ability to bring our youth back to the community and know that those resources exist that can be provided at a lesser restrictive level. It's really inspiring, and I think that the well-deserved award for North Central Healthcare and the partners who are involved, and I think we're making huge strides in our collaboration and the support that we provide families. So.
Are there any questions? Supervisor Cavelli.
Thank you, Madam Chair. I'd like to say congratulations on the recognition. I think it's important to know that, over the years that you've been working on this project, the really great success that you guys had over the last years, at least that I've been on the board. And I've seen it in the data. I think the families appreciate it. And I think that, with our vision to be the healthiest, safest, most prosperous county in Wisconsin, I think that's a huge step towards that vision. So I'm looking forward to the next few years. Thank you.
Is there any other comments? Thank you. Very prestigious award. Proud that it's in our county. Okay, moving on to 6B, Marathon County 2026 Comprehensive Plan Draft. Laura.
Thank you. So in your packet, there's another memo from me today. It is in regards to the draft of the 2026 comprehensive plan for the county. So the executive committee has initially approved a full draft for review and asked it to go to the standing committees for additional feedback and comment by February 11th so that they can, at their February 12th meeting, consider putting it out for the 30-day circulation that would then end with the public hearing and a recommendation to adopt in March. Within the comprehensive plan, there are several goals and objectives that we're asking standing committees to focus their review there, as those are the items that end up creating your next strategic plan. In particular for this committee, Chapter 3, the Health and Human Services chapter, I would encourage you to take a look at those goals and objectives and just give those a review and make sure that they're what you remember talking about and think that the county should be focusing its attention on over the next 10 years. A couple other things to say about this, just the plan has been completely updated with all the new data and plans as well, so everything is there in that draft for review. So if you are looking through it and you see an error, or, I think we've caught a couple instances where we now know a plan will be adopted, so we just need to update a date or something like that. You can share those comments with us as well, but again, would really encourage you to focus on the goals and objectives and make sure those are correct. We did spend more time trying to consider the word selection in terms of what the county's role is in that. So give that a look. And again, the executive committee is asking for feedback by no later than February 11th so that they can consider it at their February 12th meeting. So you can put this on your February agenda as well. So I think that was all I had to say about that.
Are there any questions? Supervisor Conway.
I didn't see anything specifically designed to address homelessness, which we looked at this year a bit.
So in the comprehensive plan, I would say the homelessness is addressed predominantly in Chapter 4, and I think we did have a strategy that's related in Chapter 4 or Chapter 10 related to, I know, hiring the new, what's the name of the new position at the health department? I forget. I apologize.
Homelessness Response Coordinator.
Thank you. So I know there was something related to that, but I do not believe there is an objective directly related to homelessness. There are some strategies, but I would have to go back and align them, so.
Would it not behoove us to make an objective for that specifically?
That you guys could definitely bring forth that recommendation, yes, so.
If you, my thought would be it might behoove each of you individually, if you go through all the objectives, again, to kind of frame everybody as to what the comprehensive plan, how it's laid out, similar to your strategic plan, your objective statements are very, I don't want to say vague, but they're very broad. Thank you. So for example, one of your objectives is ensure that, at least as it's currently written, ensure that every child makes it to adulthood with health, stability, and growth opportunities. That's a big thing. That talks about all things social services. It incorporates our work out at the juvenile detention center, collaboration we have with high schools. You similarly have objectives that are very broad relative to mental health, substance abuse, and all of the attendant issues related to that often intersect with homelessness. And then similarly, underneath objectives, you have specific strategies that are more targeted. And then you have outcome measures in your strategic plan, which again is the next step, that really help to provide some form of measurement to know if you're achieving the ultimate goal that the objective itself is aimed at achieving. So while there's a lot of references to homelessness throughout the document, and we do have some historical, I know Lori and her team put in some references to, it's a continuing to grow within Marathon County is the section, that's the first reference. And you do have strategies about housing, a strategy and an outcome measure about housing in the plan. So I just say that not to dissuade any adding of an objective, but it might be something that you can address a different way, which is what does a strategy look like? Just throwing that out. I mean, the document itself, as you can see, the draft is going to be in the 250 to 300 page mark. So CPZ likes to.
It's still shorter than an ERC packet, so.
Right. Packet from ERC yesterday was 400 pages. So there's a lot of information in there. So take a look, but I think your point is well taken, Supervisor Conway.
Touchy follow-up? Okay. So, I mean, we have one kind of specifically for elder care that reads, number 4 of chapter 3. Increase access to supportive services, accessible housing, and assistive technologies that enable older adults and people with disabilities to live safely and independently in their communities, which is a nice, big, broad, hey, we can do this. If we did something similar with homelessness to increase access to affordable housing, mental health services, and AODA programs that enable people experiencing housing instability to live safe and independent lives, I think would be equally broad. Maybe something that could be recommended easily.
So I guess my thought process would be, if that's something we want to look at, if this committee wants to look at that, I think possibly, and I guess I'll throw this out there to the administrator, we can make a motion that maybe myself, Ron Cavelli, and Administrator Leonard could look at this and draft something up that we could discuss at the next meeting so that we can actually have a discussion on it, if that is something that would, something people would be interested in. Since he's the homelessness task force chair, I figured it'd be the way to do it. If that's,
We certainly can do that, and I didn't do an exhaustive search other than one aided by the Control F function in your packet, but in that same community character section, under Objective 1, Section C, one of your current strategies is to support coordination, engagement, and implementation of efforts to address homelessness and its underlying causes. So if you want something more targeted than that, certainly follow up, but it's in there as a strategy, just not as it's underneath the housing, safe and affordable housing options that meet the needs of community members.
is this under an actionable item? Do we have it listed as an actionable item?
Just education.
Education
Just
today.
education, would it be okay to make a motion even though it's not an actionable item?
Corporation Counsel, what do you say to
It's, the way it's.
Our short answer has
agendized.
always been no, if it's just for education and committee
I
discussion.
say no, but, and I don't think you need a motion to
Just-
have, less than a quorum of your committee get together to work on something with the administrator if it's necessary, so.
Without approval, I think what I just said, I'm gonna try to do if that's okay.
And I've earned my pay for the day, so.
Yeah.
Supervisor Foot.
Thank you. I kind of like the wording that we have because it's broad. Because today we have the problems we have today, and tomorrow we might have the problems that we have tomorrow, and we still have to deal with both of them. I don't know, I feel like that by saying promote a variety of safe and affordable housing options that meet the needs of all community members, that means everyone, even people that don't have a house currently, right? So, I don't know, that's just my opinion.
All right, well then just a follow-up, I guess, if it's, everyone's on the same page, we would just actually just discuss it at the next meeting then? We could do that as well. I guess we don't have to have something, we'll just, we'll put it as an actionable item if we want to change anything. Read through that section Lance just pointed out, and then we'll just discuss it at last meeting and I'll agendize it as an actionable item.
And the section he is pointing out is in chapter 13. So at the end of chapter 4, it just lists the objectives, but then if you go to chapter 13, you'll find the strategies. But I can send that out to you separately too, just to make it so you don't have to dig through 262 pages.
That sounds good, Lori. Go ahead and send that out to us.
Okay.
Any other comments, questions? Ooh. Supervisor Cavelli.
Thank you, Madam Chair. I kind of agree with Administrator Leonard that we do have different sections addressing it. And on page 62 of the Marathon County Comprehensive Plan Draft, It does talk about the homeless services and our path forward for that, including the position for the public health coordinator for homelessness. So I think it's in there. I just think it's just not all in one section like we think it should be, but we can take a look at that to see if we need to adjust it. But it does start on page 62 of the draft. So if you want to take a look at that section with the homeless services, so.
Any other comments? Seeing none? We'll move on to number 7, next meeting date and time, announcements, and future agenda items. A, committee members are asked to bring ideas for future discussion. And B, next meeting is Wednesday, February 4th at 3 p.m. Moving on to number 8. Moved by Supervisor Boots, second by Supervisor Foote. All in favor? Aye. Opposed? We are adjourned.
Thank you.